Hello and welcome back to USTM Podcast, where we bring you expert discussion on topic that matters. I'm your host, Fetisha Syiemiong, a student of law at University Law and Research USTM. In today's topic, we'll be diving into a crucial health concern which has been in a rise, which is tinnitus. Tinnitus is often described as the hearing and buzzing sound in our ears. But what actually causes it and how do we prevent it? In order to answer all these questions, we have an expert with us today, Dr. Shruti, Assistant Professor of ENT Department at BA Sangma International Medical College and Hospital, Meghalaya. Dr. Shruti, we welcome you to USTM Podcast and we are delighted to have you with us today.
Thank you so much, Fetisha. I really appreciate this opportunity provided by USTM to throw some light on a very common but much less talked about health issue, which is tinnitus. And the timing couldn't have been more apt because we recently celebrated the Tinnitus Awareness Week in the first week of February, and the theme was breaking the silence on the unseen struggles. So yes, I'm really looking forward to this podcast.
Dr. Shruti, let's begin with the basic. What exactly is tinnitus and how does it affect us in our daily life?
So tinnitus is the perception of a phantom sound in the ears or the head in the absence of any identifiable source. So a person may hear a buzzing or a ringing sound which is only audible to the affected individual. Now, it does not necessarily have to be a high-pitched ringing or a buzzing. It can also be like the whooshing of a fan or wind, or the hissing sound of a tea kettle or a pressure cooker. So now tinnitus is not a disease in itself, but it can be associated with so many other diseases of the ear. So it's important to know why it is happening. Now, since you asked me about how it affects, the important part is tinnitus can have a very negative effect on a person's quality of life. It can affect the quality of sleep, it can affect your concentration at work, even your day-to-day conversations. So all of this can result in undue stress, fatigue, insomnia, and depression and anxiety. So it's important to know about tinnitus.
Ma'am, as you have highlighted that tinnitus is not a disease, so what is the primary cause and why, according to you, is it increasing?
Okay, before I talk about the causes of tinnitus, I would like to brief you about the types of tinnitus. So there are two types, objective type and the subjective type. Now the objective type is where the individual as well as the examiner will hear the sound of the tinnitus, and these are commonly associated with vascular tumors of the head and neck region. But for this talk, I would like to restrain myself to the subjective type where only the individual hears the sound. Now, subjective tinnitus is not caused by a single factor. It is a multifactorial process. Multiple risk factors, they accumulate over time and cause tinnitus. Now, the most important risk factor is hearing loss. And we have seen that patients who have hearing loss eventually do develop tinnitus. And this correlates with studies that show that the frequency of hearing loss directly correlates to the frequency of the tinnitus heard by the patient. Apart from that, people who are continuously exposed to occupational loud noise, those who are exposed to recreational loud noise, they are definitely exposed to tinnitus, developing tinnitus. And we have certain medications called the ototoxic drugs. So these medicines, even though we prescribe on a regular basis, have a negative effect on the auditory nerve. So certain drugs that are used in chemotherapy like cisplatin, carboplatin. Again, there are antibiotics that we give in a routine basis like streptomycin, gentamicin. All of these can cause tinnitus. Now, what we have seen in recent times, to answer the second part of your question, what change we have seen in the recent times is that previously tinnitus was being reported in the older population, but now we see an increasing number of cases in the younger population. Now, why is this happening? And this is possibly because of the increased use of personal listening devices. A lot of young adults are using personal listening devices for their work, for their education. What happens is when they are using it for a long duration at a loud volume, then it can cause tinnitus. This is the change that we have seen over time. And there has also been an increase in loudness in the ambient noise, and lifestyles are becoming more stressful, anxiety levels are increasing. All of these factors, they contribute to developing tinnitus.
Ma'am, as you have mentioned that stress can worsen tinnitus, so what exactly is the connection of tinnitus with stress?
So Fetisha, to answer that question, I'll be talking about something called the tinnitus reaction circle. So this is a negative loop that happens in tinnitus, wherein when the person first hears the sound of tinnitus, it perceives it as a negative emotional response. And whenever there's a negative emotional response, the brain thinks of it as a threat to the body. And when it identifies it as a threat, so it searches out for it. The brain is vigilant, it is searching out for the noise. And the more it searches out, the more the patient can hear the tinnitus. So this loop continues, and it's a very negative kind of a loop, and it causes a lot of stress to the patient. So the brain's response to stress heightens the sensitivity of tinnitus in the individual. Now, these factors like stress, anxiety, depression, all of these, they are both a risk factor as well as a consequence of tinnitus. And it is sometimes very difficult to pinpoint exactly whether it was this comorbidity of stress, depression, was it a risk factor or is it a consequence? Because by the time patient comes to you, you cannot recollect. But there is a definite connection. We know this because whenever we ask the patient or we advise the patient to do certain stress relieving exercises like yoga, meditation, then there is a definite reduction in the severity of the tinnitus. So yes, stress and tinnitus, the pathophysiology, they overlap, but we cannot exactly say whether it was a risk factor or it is a consequence.
Thank you so much, ma'am, for explaining us the connection between stress and tinnitus. So, in modern times, due to prolonged noise exposure, and we youngsters are really into games these days. So, how does this prolonged exposure to noise contribute to tinnitus?
So yes, Fetisha, you're right. A large number of studies have confirmed that exposure to loud noise and for a long duration can cause tinnitus, that you are more prone to developing tinnitus, and this is seen more commonly in youngsters. So what happens when you're exposed to loud noise? I'll go at a cellular level for this question. Okay, so our organ of hearing, or the cochlea, it has two types of cells, the outer hair cells and the inner hair cells. What are hair cells? They are different from regular cells in that they have hair or cilia. And these cilia, they vibrate and they cause the sound to go ahead or into the brain. Now, when we are exposed to a loud noise, then what happens is it affects these outer hair cells. The hair or the cilia on the hair cells are affected. Now, there's something called the heat shock protein, which protects the hair cells from this loud noise. But if we hear the loud noise or we are exposed to the loud noise for a long duration, then there is a deficiency of the heat shock protein. Now, in the absence of the heat shock protein, the cilia, they are damaged. And if we continue this process for a long duration, and over time, the transient damage that was caused to the hair cells becomes permanent damage, and then that leads to auditory nerve damage and hearing loss and tinnitus.
Ma'am, since we have a lot of rules and regulation in India for regulating noise pollution, so ma'am, do you think these rules and regulation are enough, or do you think they require more awareness and stricter measure in order to protect the public?
Yes, Fetisha, the rules are definitely there in the books. They were even amended in 2010, I believe. So the noise pollution rules have clearly state the permissible noise levels in different parts of the society. It has been segregated into areas. So in an industrial area, the permissible noise level is 75 decibels during the daytime and 70 decibels at night. Whereas in a residential area, it will be 55 decibels during the daytime and 45 at nighttime. But in practicality, in a densely populated city like Guwahati or in India, where all the cities are very densely populated, I don't think there is a clear-cut demarcation of a commercial area or a residential area, leaving a few cities behind. So I think it's very difficult to enforce the law in such a condition, right? And apart from that, there is also a rule that you should not be using loud amplifiers or loudspeakers at night in an open ground. It says that when you're using a loudspeaker or an amplifier, you should be confined within an auditorium or a conference hall. But we do see that there are conferences happening in the open. Also, any kind of sound emitting construction work cannot be carried out at night according to the rule book. But obviously, we understand that law enforcement in a country like India, it's not very practical to completely abide by the book. We have to keep in mind a lot of factors. So instead of taking law enforcement in our hands, what we can do as law-abiding citizens, I believe, is be more responsible, be more mindful about not creating a nuisance for others when we are listening to music, or when any construction work is happening at our home, we limit it during the daytime. So I think these are the steps we can take to abide by the rules that has been listed.
Ma'am, I agree with you regarding that there are various rules and regulations to regulate noise pollution, but I also agree that it's we the citizens who has to take care of it. Like in the hospital area, I often notice that people give loud horn where it's not allowed to do so, but we do it. So it's us who should do it. I agree with that. So ma'am, like since infection can also cause tinnitus, so can you more elaborate on that?
Yes, Fetisha, ear infections can cause tinnitus. So if there is some kind of fluid in the middle ear, that is behind your eardrum, when there is collection of fluid, which we call as otitis media with effusion, or there is chronic otitis media, that is infection of the middle ear, these can eventually lead to tinnitus. In case of OME, there might be a thumping sound. Okay, and if there is a long duration of ear infection which is untreated, then it finally affects the auditory nerve. So when the auditory nerve is damaged, there is hearing loss and tinnitus. So that is how infections can lead to tinnitus.
Ma'am, since you have elaborated on ear infection can cause tinnitus, so what are the common symptoms one should not ignore?
Yes, Fetisha, that's a very important question. And the symptoms they can be varied. Okay, so most important is the ear discharge. If there is any kind of ear discharge, like whether it's watery or purulent discharge, whether it's smelly or not, you should always seek medical help. And then again, there is the sensation of a blocked feeling in your ears, or a feeling of water or fluid in your ears. In such cases also, it is advisable to seek help. Apart from that, if you are suffering from ear pain or reduced hearing, or even the ringing sensation of tinnitus, all of these are symptoms of ear infection, and you should immediately seek help.
Ma'am, as you have talked about the symptoms, apart from all the symptoms, if someone experiences ringing sound in their ears, so should they visit a doctor immediately, or like when should they visit?
So the answer to that, Fetisha, is as early as possible. Now, studies have shown that if you present early during the course of your disease, then the result, that is the treatment that we can give, is more effective. Okay, so if a patient comes to you in the early stage of tinnitus compared to a chronic tinnitus, we can give them better treatment options. There are more number of treatment options that can be given. So if you are hearing a buzzing sound or a ringing sound, then immediately go to an ENT doctor, get an audiological assessment done, and then the doctor will rule out any other cause which is causing the tinnitus and guide you towards the best possible treatment option.
Ma'am, since these days many of us are into home remedies, so are there any home remedies, medical treatment, or therapies to manage this tinnitus?
So, Fetisha, I'll come to the home remedies part later. First, I'd like to focus on the management of tinnitus. Now, the management of tinnitus is targeted at first finding out the cause of tinnitus and addressing it, and simultaneously also making the patient habituated to the sound of tinnitus. Now, coming to the causes of tinnitus, so if the patient has a hearing loss, what we can do is get a pure tone audiometry or a hearing test done to identify the frequency of loss, as well as to identify the frequency of the tinnitus sound. Now, once we have done that, we can prescribe a hearing aid which also has an inbuilt masking feature. Now, this masking feature will provide a sound at the same frequency as the tinnitus and help the patient getting habituated to the sound of tinnitus so that it becomes less bothersome. The second and very effective therapy is the cognitive behavioral therapy, or CBT. So this aims at reducing the stress which tinnitus can create. So a cognitive counseling or response is created where the patient will finally get habituated and accustomed or mindful about their tinnitus and not treat it as a negative, negative continuous stress factor. So that is CBT, and it is done by psychologists. There are counseling sessions for this. The third available option is the tinnitus retraining therapy. Now, tinnitus retraining therapy is CBT, that is counseling, plus a sound therapy. Now, what is sound therapy? It is same as masking, but we call the patient for sessions, wherein we subject the patient to the same frequency or of bandwidth of sound, as the sound of the tinnitus that the patient is hearing. We call the patient regularly for sessions where we subject them to this sound for a certain period of time, and then eventually the patient gets habituated to that sound. And so when we combine these two factors, the results are more effective. Now, for people for whom tinnitus is not so bothersome, they can also manage it at home by self-masking. Now, what is self-masking? You can buy machines which produce white noise. They are called the white noise machines. Or nowadays, white noise is even available free on YouTube. So you can identify what the frequency of your tinnitus is and find a noise of the exact same frequency. So basically, it's when two sounds of the same frequency, same wavelength, when they're coming from the opposite direction, they cancel each other. So the patient gets habituated. Okay, so in patients who are having difficulty in falling asleep, because during nighttime it is a quiet environment, and that is when the patient appreciates the tinnitus more. So they can use this white noise machine or white noise on YouTube, and when they will hear that white noise in the background, it will help them get habituated to it, and it will be easier for them to fall asleep. So this helps in reducing insomnia, undue stress, anxiety, and frustration. So these are the management options available. Now, coming to your home remedies part. Okay? Now, I want to stress that there is no particular home remedy, like don't go ahead and put hot oil or paste in your ear. That can be very harmful to your ears. It can cause infections. Instead, there are certain lifestyle modifications that you can adopt. Okay, especially for people with tinnitus, these are advisable, in fact. Okay? The firstly is to cut down or completely avoid alcohol and smoking. And next is there has been some association with increased caffeine intake. So regulate your caffeine intake, keep it to a minimal possible amount. And apart from that, like I mentioned before, there are certain things that reduce stress, like yoga, mindful meditations, even regular exercise. It helps improve circulation. So as a result of that, it reduces stress. So all of these factors, these reduce stress, thereby they reduce the severity of tinnitus. Okay, and finally, but not the least, of course, it is a very important change that we can adopt, is improve our diet. A balanced, wholesome diet is very important, especially the B vitamins in leafy vegetables, green leafy vegetables, then maybe fish oil, and foods rich in zinc and magnesium and selenium. These are very important for neural health. So whenever there is a transient loss or transient damage to the hair cells, if we have a very good nutritious food, then the damage can be recovered. It will heal. Okay, so balanced diet is equally important. So these are the lifestyle changes that we can do at home and see an improvement in our tinnitus.
Dr. Shruti, it was great having conversation with you. So before we wrap up this session, do you have any final advice to the viewers?
Yes, Fetisha, I also had a very good time talking to you about tinnitus. And the take-home message, like I've already listed the precautions, I would like to stress on them again. That is, be mindful about your listening habits. Follow the 60-60 rule, like I've mentioned before, where you keep the duration to less than 60 minutes and the volume to below 60%, and preferably use headphones over earphones. Most importantly is, if there is any symptom, if you hear a ringing sound, or even apart from tinnitus, if there is any other symptom of the ear, seek medical help. Okay, there is no harm in seeking help, right? So if you can go early, if the disease is detected early, the cure is definitely possible. So yeah, that's the take-home message. Thank you so much.
Thank you so much, Dr. Shruti, for being with us today. And you have shed light on various important topics, like how one should prevent tinnitus, how one should use the 60-60 rule while using earphones or earbuds. And also you have mentioned what's the connection of stress with tinnitus. So thank you very much. I'm really sure that our viewers has gained valuable insight from today's session.
Thank you so much, Fetisha. I had a good time too.
And to everyone watching, we hope this discussion has helped you understand tinnitus better and the correct step to be taken for better hearing health. If you have found this podcast informative, please like, subscribe, and share to our channel. And also stay updated and stay connected with us. Until next time, take care, stay safe.